Okay, so we are looking at PowerPoint 2 today in our PFT 106 class. So this is going to be how to work with multiple conditions or comorbidities. That's sort of what this topic is on. And basically this is, you can think of this as like a general principles or general guidelines thing for the rest of like this course, right? So like, I break this down for you guys all the time. I always like to break the idea of like problem solving down into 3 steps, right? When we look at like problem solving, step 1, you have to accurately identify a problem, right? So figure out like what's going on, separate any of the relevant from the irrelevant information, figure out like what's actually causing your problem. Like if you're like, oh, I'm not making enough, I'm not making enough money. Is that the problem, or is it that there isn't a good balance in your finances, right? Could be that you're not making enough money. That could absolutely be the real problem. But sometimes like a lot we'll kind of jump to a conclusion and label it a problem rather than like taking time to analyze what's actually the problem, right? Or like, oh, I don't have enough time in the day. It's like, do you not have enough time in the day? Or is it that you are spending too much of your time doing something that, is kind of, do you watch a lot of YouTube on your phone, or I eat really healthy and I still can't lose weight. It's like, do you eat really healthy? And if you do, like, can you not lose weight? Is it because you're not moving enough, or flip it around, I can't lose weight. Is it because you're moving plenty? Or because you're not eating enough. So like, or eating properly. So that, separate the relatives, identify and accurately identify like your problem, right? And then step 2, you got to solve that problem, right? You got to come up with like a solution. So generate a list of like solutions to your problem. If your problem from, the first one we looked at was like, I don't make enough money. And then you found that maybe the accurate assessment wasn't that you don't necessarily make enough money. It was that you're not so great with your finances and you tend to like spend more than you should, right? Okay, so that's great. Now that we've, let's come up with a solution to that problem, right? So maybe, for me, this is something that helped, having 2 separate banking accounts, one for like essential bills and things, and one for goofing around. One that's like a spending account, that was huge. I remember when I had to do that for sure when I was like doing, and this is actually just a general really good tip for you guys. When I was doing a lot of like personal training, like one-on-ones, when I was training out of people's houses and stuff, I still had like my regular job, right? Like I was working at Biggest Loser at the time, doing like group exercise and stuff like that. But like my biggest thing was like where I made most of my money was training out of people's houses and stuff. And eventually it got to where I was working like, 55, 56 hours a week. And I was like, all right, I'm super burnt out. I feel like I am 90 and I'm in my 20s. And eventually I started like kind of tapering that down a little bit. So, at the time, here's something you really want to avoid doing. When you are billing your clients, you are going to bill them up front for however many sessions they get. So if let's say you get somebody who purchases like a 12 session package, right? And what you want to do is with your prices, you want to like, sell it in packages, large numbers so that you have a guaranteed number of sessions, which is really great. But let's say you're charging $100 a session, you get 12 sessions up front, you just got a $1,200 check, right? If that goes into your bank account and you're like, $1,200 in one day, and then you spend all of that $1,200, that's just something that like, 24-year-old me loved doing. Not actually the best choice, because what's going to happen is like, those 12 sessions might go over the next like 3 months if your client's only meeting a few times a week, or however long it takes, to go through those sessions. So you might not get another check for several, and you're still working, and now suddenly like your funds have dried up. So one of the things I recommend doing, and this is something that I took out of the book of like the way actual gyms work, is you deposit that $1,200 into an account, and it just sits there. And then every time you train your client, you move the session's price worth of money from one account over to the other. Now, I didn't do it every single session. Like if I trained like 5 sessions, I wasn't doing like 5 transactions over in a day. But at the end of the week, I'd be like, okay, I trained 16 sessions this week. So 16 sessions, I'm going to move that money from my, deposited account into my spending account. So Anyway, I'm kind of tangenting a little bit, but that's a way there. That was a solution that I came up with to, solve my spending problem that I had in my early 20s. So step one, accurately identify a problem. Step two, solve that problem. Step three, was me opening a couple checking accounts online, right? And that's, implementing your solution. So step three is implementing your solution, right? Once you come up with a solution, you got to do it, right? So identify, solve, implement. Let's look at another example. Let's say that client we were talking about, they says they're doing everything they can, but they aren't losing weight, right? And then we accurately identify the problem. And it's like, well, you're doing everything you can except moving enough, right? Like you're exercising every single day, but you're spending the rest of the day being very, very sedentary. And so your body's finding a way to kind of balance out that energy deficit that you're creating. And turns out you're not creating an energy deficit, right? Maybe you worked out in the morning, but then you spend the rest of the day sitting because you're just really low energy after that super hard workout, right? So there's our actual problem. Our problem is not that you're working out too little. Your problem is that you're moving too little after your workouts. So now let's come up with a solution. Why don't we put an alarm on our phone every couple hours? We're going to get up from our desk, walk around the office, do some stretches, and then sit back down and get back to work. Right, there's our solution. We'll try it out, see if it works, and then, see how that goes. And then over the next few, we download an app on our phone that allows us to do that. Me as the trainer, maybe I help my client come up with a couple stretches they can do, like a small little miniature routine, just something that takes 5 minutes. And so every couple hours, they get a 5-minute break where they just go do something physical. And see if that works. And over the next couple of weeks, we're going to see. So we identified the problem accurately. We came up with a solution, and then we implemented that solution. So the reason I'm talking about this is because today we are going to be, today we're, sorry, that wasn't me hitting one of the dogs. Dogs are outside the room. I was hitting my computer. It was buzzing. So today we're going to be looking at how to work with multiple conditions. Comorbidities, right? So comorbidities is a term used to describe like multiple conditions somebody is dealing with, right? So, when someone has like coronary heart disease, right? A lot of times they'll have other conditions that are related to that. Their coronary heart disease is being caused because they have elevated blood pressure, right? And high cholesterol at the same time. So both of those things are what's causing, that blockage in their coronary arteries. So these are multiple conditions that someone could be dealing with simultaneously, right? So a lot of individuals are going to have multiple conditions that they're dealing with. It's very, very common, a lot of times, like even things like if you have, some type of like traumatic injury, it can lead to a reduction in movement, and then that reduction in movement causes like other problems, right? For instance, like when people get like knee surgery, it's kind of crazy. But your knee is a huge joint, right? We just looked at it. It's the biggest joint in your body, right? So because of that, because of how much space there is there, your body, it's like a great place for scar tissue to form like crazy. So your body's like, oh, I'm going to fill all this empty space with scar tissue. And that's super what you don't want to have happen, because now you have lack of space. So when they give someone like knee replacement surgery, what they will do is get them into physical therapy literally sometimes that day. A lot of times they'll have them doing physical therapy like the next day. But like if your surgery is at like 7 a.m., you might be up and walking on your feet doing physical therapy later that day. And you just had a part of your body replaced. Which sounds really harsh, but the reason they do that is because like the more sedentary you are, the more time there is for scar tissue to build up in your knee. So they will get you stretching and walking as absolutely fast as possible to keep that from happening. And I've worked with clients who have I had a client who had both knees replaced. And he was a great example of this. I'll never forget it. He had both of his knees replaced, and that was a couple years apart apparently. And the first one, he was like, oh yeah, I didn't listen to my physical therapist, didn't listen to my doctor, didn't do my stretches. My second one, I definitely did, because I learned my lesson from the first one. And this dude, when you would stretch his quadriceps, it looked like this. Like you would be like, you could get one to like right here, and that was about as far. is he could like bring his quad in. It would get stuck there. And the other one, he had full range of motion. And it was crazy. It was like night and day. Um, and it was just because like, you know, he didn't do it as a physical therapy the first time around. So, you know, that's sort of what we are sometimes seeing there, right? We want to make sure that like our clients are going to have different limitations. So because he had so many knee problems, guess what? He was also really sedentary. His knees ached for a long time. And so like, you know, that's why he had to kind of take control of his life and start getting more active. But, you know, by that point, he was already in his 70s. So, that's definitely something we want to be aware of, right? Your clients are going to have different conditions that can lead to different limitations. It can lead to different athletic abilities, and we need to be aware of all of them. So when we're working with individuals who have comorbidities, you know, multiple conditions, we're going to make sure that like, you know, because exercise is going to be such an elevated state of like what your body is up to currently, right? Like your body is in this super elevated state. Your blood's pumping faster, your heart rate is faster. Well, obviously, you're breathing more, temperature is higher, right? Hormones are going crazy. All of those things are happening simultaneously. And so because of that, sorry, 1 second. God. Because of that, you're definitely going to see weak links show up more easily, right? So it's going to really reveal any weak links that your client has, and that's kind of a good thing, right? It's kind of exactly what we're going for, because like that'll show us what we can like actively work on as their trainer. So I always love this. I love this quote here, but it can reveal your client's functional capacity, right? This is kind of what we were looking at yesterday. We don't want to label our clients as dysfunctional. We want to label our clients as measurably functional, right? They have a functional capacity. The example I gave last night was like, if you have somebody who lost an arm, it doesn't mean they can't exercise. It means they can't do 2 arm exercises. They can still absolutely exercise, right? They're measurably functional. So that's kind of what we're looking at. Even if your client has a million different conditions, there's still something they can do. If you guys want to watch the most I've mentioned this before because it had such a huge impact on me, but if you want to watch one of the most inspiring freaking movies ever, it's not even meant to be like a super inspiring movie. It's meant to be a freaking commercial. But check out Fat, Sick, and Nearly Dead. It is a documentary all about juicing. Do not fall for juicing. I am not a huge fan of juicing. I think it can be fine. But I'm not saying it's the end all be all, but there is a moment at the end, right? And the whole thing is about this guy who lost a ton of weight while he was like juicing. And he's trying to convince other people to join him on this juicing journey. And everybody's like, no. Like it's like a million people are like, I'm not interested. And then he finds this one truck driver who is like, yeah, I'll do it. And so he like reaches out to him, and then like it shows you in this documentary like the guy who's, you know, kind of the main guy, who by the way is the CEO of a juicer, a company that makes juicers. So remember, this is definitely like a commercial. But like he goes to this guy's house and he's like, all right, well, you know, we got to juice, but we also got to exercise. He's like, how much exercise can you do? And he's like, I have no idea. And he's like, okay, well, let's see, like how much, let's just go for a walk right now. How far do you think you could walk? And the guy goes, I'll probably out to the front mailbox and back. And it's like, that's his entire capacity. And so he's like, great, all right, let's do it. And sure enough, the guy gets off the couch, walks to the mailbox, walks back and sits down, and he is exhausted. And it's like, that is how out of shape this guy was. And it's this moment where you're like, wow. You know, and he's just like wheezing and gasping for breath. And then, so they continue filming this documentary. They get all the editing done. And then at the end, this like little title screen pops up and it's like, we checked back in with truck driver guy, X number of months later, who's still on his weight loss journey at the time that we were going to release this film. So they checked back in with him, and this guy lived in like Wisconsin, I think, or like Michigan or Mississippi or something like that, like somewhere in the Midwest where it's like super snowy. And he goes out to this guy, and it's the middle of winter, and he has lost probably 200 pounds at this point, maybe even more. And he's strapping on like a snow jacket and snow pants and going for a jog in like the middle of winter. Like he's so dedicated to actually, like this guy who could not walk to his mailbox and back without being out of breath is now strapping on winter clothes to go for a run in the middle of winter. And like, I remember the first time I watched this, I was like, oh my God, I was like crying. I was like, that's the most inspiring thing I've ever seen. So like, anyway, if you ever want to like experience that, look it up on YouTube. It's just the amazing moment. But that's functional capacity right there, right? It doesn't matter what someone's capacity is. Everyone has a measurable capacity, right? Figure out how many feet it is to the mailbox and back, right? And then next time, you're going to go from the mailbox, you're going to go to your front fence. You're going to go across the street. You're going to go down to the end of the block. You're going to go around the block, right? And we're just going to measure that improvement, and it's awesome, right? That is true of anybody who, you know, might be dealing with coronary heart disease, hypertension, diabetes, osteoporosis, arthritis. They might be a cancer patient, right? Doesn't matter who they are. Everybody's going to have a measurable capacity. So that's what's so great about exercise. We can kind of measure that capacity and we can work on it, right? So here's kind of an interesting little chart that I want to show you guys. So the primary cause in individuals with most chronic diseases is often heart disease. So like even like we've seen heart disease be linked to diabetes. We've seen heart disease linked to arthritis even. So it's interesting because you're like, wait, what could my cardiovascular system possibly have to do with like my joints, right? Well, remember, like your heart is what pumps blood around the body and like provides you with energy. If you don't have energy to move, you might do things that result in like your cartilage degrading over time, right? So multiple chronic diseases, right? So this is where we can kind of see the opposite here, where like when load is high, how are you going to feel? Your energy is going to be low, right? So like load is high, energy is low. And so we start to see things like hemodynamic overload, for instance, right? So what that means is basically, it's a big fancy way of saying hypertension or stenosis of the aorta, which is basically a hardening of your aorta, which is meant to be very flexible so that blood can travel through it. We start to see like cardiomyopathy, which is really dangerous. That is going to be like differences in like the size of your heart shrinking. So we start to see like really dangerous things happening there. And so like that can be really dangerous and an example of like a failing heart. But we also see things like cardiac insult, which is pretty much as dangerous as it gets, where we start to see things like myocarditis, where there's actually fat building up around your heart, ischemic heart disease, you know, all these like very dangerous things. Ischemic heart disease is basically where you'll start to get like nerve damage in your heart, and then your nervous system has a hard time controlling your heart, which is still under the control of your nervous system. And so that can sometimes lead to like, you know, anyway, we see how this chart is like all linked, right? Look at all the arrows going in all these different directions, right? We can see that leads to oxidative stress, which could be cancer related. We see all kinds of really, really dangerous things. And so the heart really is at the center of, you know, the center of like our health, right? In the same way that it's in the center of your chest. So, that is sort of why we need to kind of be aware of like aerobic assessments and why those are going to be very, very important for us. You'll notice we are going to have different types of assessments we are going to perform with our clients, right? We talked a little bit about this yesterday, but we have, and it's kind of funny because we have postural assessments, which are related to how our clients are meant to move, right? It's like we're analyzing posture based on how things look, right? Is your head sitting like up top on your body? Are you rounding your shoulders, right? Are you laterally shifting? Your knees caving in, feet turning out, whatever, right? And so that's postural assessments. We also have neuromuscular assessments where it's like, how's your balance, right? Like how strong is your core and how strong is the bottom of your foot? You know, balance is located basically in 3 parts in your body. It's the bottom of your foot, your core, and your inner ear, actually. But your nervous system has to interpret all that information to keep you in balance. If it can't interpret it properly, you're not going to have good balance. So we definitely want to be, you know, kind of aware of that. But look at this one here. You can see 2 major categories of assessments that are related to your cardiovascular system. So you can see why this is so important, right? So aerobic assessments wise, we have things like the YMCA 3-minute step test and the Rockport walk test. Both of these are really, really great. But the YMCA 3-minute step test is basically an assessment where you have your client go through the same amount of stress as anybody else. So what you have to do when you're doing the YMCA 3-minute step test, you need to make sure that you always pick a 12-inch box. So everyone is going to use the exact same height box. Actually, if you ever have like a situation where you're in a gym and you have like the little risers, this is actually probably what most of you guys will do your 3-minute step test on. These little risers right here, you use 3. That's perfectly like the right height. And what you'll do is you have your client step with, you see it's his left foot, and then actually this picture's out of order. He would go left foot, and then he would bring his other foot up, and then he would step down. So he goes left, right, up, up, down, down, up, down, down. And he's gonna go at the same pace as everybody else. That pace is gonna be 96 steps per minute. So you set a metronome to 96, and you hit play. I'll just leave that on for the rest of class. No. So that's 96 beats per minute, right? So now we have eliminated any of the guesswork, right? Bob, Janet, Steve, Robert, Jesse, Noel, everybody who takes this assessment, they're all going to do it on a 12-inch step. And they're all going to do it at the exact same pace, 96 steps per minute, right? And they're all going to do it for the exact same length, which is going to be 3 minutes in time, right? So everybody gets the same amount of stress. Now, because when they were developing this test, they put many people through it, they determined like what a good recovery pulse is for these heart rates. So when you are done with your client and they're done, what they're going to do, usually you want to have a chair nearby, although what I often do is I just have my client sit on the step that we built. You're going to have your client turn and sit into a chair or onto the step, and they're going to present their left arm, and you're going to take their pulse for a full 60 seconds. That is going to tell you what their recovery pulse is, right? So their pulse is going to slowly, slowly go down over the course of that minute. So it might be like, till it gets back to a normal heart rhythm, right? And you're just basically going to count how many beats it takes over the course of that 60 seconds. So they measured what a good score would be, and they measured what a bad score would be. And we have standardized tables for where people should be landing in terms of what their recovery pulse is. And you can see those tables right here, right? If we see our clients, let's say they're 45 years old, right? And their recovery pulse was 116, right? That's between 113 and 119. That means that their recovery pulse was below average. That means that this client's heart is not in very good shape, right? So because their heart's not in the best shape, what are we going to prioritize? Cardiovascular and endurance-based exercise, right? So we're definitely going to spend some time working on cardio with this client. But let's say your client's heart rate at the end of that was like 82, right? Well, that means that their heart is in awesome shape. And guess what? We're still going to do cardio exercise. We may not have to do quite as much of it, but we can do much more intense cardio exercise. So this person qualifies for like, all right, let's max their heart rate out and focus on some really intense exercise. Whereas this client over here, the first one, we're going to focus on gentle exercise until we can build up our base. We're going to continue reassessing over the next few months until eventually we can push them harder and harder and harder. So maybe we start them with 60% of their heart rate max, then we push them to 70%, up to 80, up to 90, right? That's kind of what we're looking at for a 3-minute step test. Jesse, Robert, I know you guys have seen this before. Noel, this is your first time seeing the 3-minute step test. Does that make sense? We're going to go over it again for sure, but does that kind of track for you?
Yeah, kind of.
Yeah, what's the kind
of? I guess it's the whole graph thing. You know what I'm saying? And like how to measure the timing, the pulse.
Sure.
And yeah.
So don't get me wrong, we're gonna teach you how to like gather pulse and stuff. But so yeah, so the timing is always 3 minutes every client, and then the time that you take their heart rate afterwards is always for a full 60 seconds.
Okay.
So like here's the thing, like after you do something intense, right, your heart rate's high, and then when you sit down, your heart rate starts to go down, right? So what we're measuring is they call it your recovery pulse because we're measuring how like a heart that returns to a normal pace really quickly is a heart that's in really good shape. But a heart that kind of like stays elevated and takes a really long time to recover, that shows us that the heart is not in such good shape. They actually took this out of the book, but in the version of the NASM that I got certified in, one of like the key like terms to use, and it was a question on my test, was like, what is the textbook definition of fitness? And they used to define, now they took that out because it was like, yeah, it's kind of silly. But like the definition of fitness used to be how quickly your heart rate returns to normal after intense exercise. So it wasn't about how much weight you could lift, how fast you could run, or how high you could jump, or anything like that. It was about like, does your heart rate return to normal quickly, or does your heart rate return to normal slowly? If it's quick, you're in good shape. If your heart rate's slow, you're in if it returns slowly, you're in bad shape.
But when do you start that the first week, like the first week of it of the workouts,
I would start
and
this.
then
I would start this before the first week. I would do this on the
okay,
first meeting with my client. I want to know what we always want to do assessments right in the
because
beginning.
each individual are different. You know what I'm saying? They're different. All of them might be, one might be in shape, the other might be partially in shape, the other one not in shape.
Yeah,
You know what I'm
absolutely.
saying? So it's
So
like different.
yeah, so
So how you gonna
exactly. So
balance that?
my question to you, if everybody's in different shape, right, is how do we tell who's in good shape? How do we tell who's in bad shape? Right? That's why we do the assessment. Because once we figure out, like, I can't figure out whether you're in good shape or whether you're in bad shape unless I put you through some type of stress first. So I'm going to do this with you on the first session and see what your pulse is. And then that's going to tell me how hard to work you out, right? That way I don't overdo it, which is what's important. Does that make sense?
Right. Yep.
Yeah,
So you don't over once you find out, you work your way to progressive to harder things, right? You start off
exactly.
easy, then you start working your way up gradually.
Perfect. Yep, absolutely. But I can't do that unless I know your starting point. So I need to put you through this 3-minute step test, and that's why everybody gets the same test. That's why everybody gets 12 inches. Everybody gets 96. That way I know I'm putting the same amount of stress on everyone who's ever taken the test ever. And some people perform really well on it. Great, they get a super hard workout. People who don't perform super well on it, great. I'm going to build you up to doing a super hard workout. It just might take a little while longer.
Right.
So yeah, so that's the 3-minute step test. That is one of our cardiorespiratory assessments for aerobic. This is an aerobic assessment, right? It's an aerobic capacity assessment. Another one that we have, let's say, here's the thing. Sometimes like 12 inches stepping up and down, sometimes that's just high impact. If you caught a client who has like arthritis or something, they're not going to be able to do that. It's going to be way too difficult. And the impact is going to wreak havoc on their knees and hips and feet and everything. So instead, we have alternative assessments out there. We have the Rockport walk test. And the Rockport walk test might be more appropriate for some clients compared to others. And that's basically where you're going to put somebody and you're going to tell them, all right, we're going to walk 1 mile. And I want you to do it as fast as you can. And that's it. That's the whole assessment. They're going to walk a mile as fast as they can. So you're going to maybe walk with them. I recommend doing this. I mean, you can do this on a treadmill, but I'll warn you, treadmills tend to kind of push back a little harder. So usually when people do this, it's much more comfortable to do it on like a physical track. So if you know where there's like a track in your neighborhood, I recommend doing it there and do a mile. But let's say you have this client walk like a full mile, and what you're going to do is you're going to measure 2 things. You're going to measure how long it took them, and you're going to measure what their heart rate is at the end of the test. So this is different than the YMCA 3-minute step test. The YMCA 3-minute step test, we were measuring their pulse as it recovered for a full minute. The Rockport walk test, I want to know what your heart rate is the second that mile is over, and I just want a flat number, not your recovery pulse, what your exercise pulse is. So basically, I'm just going to get your pulse. I'm going to measure it for maybe 6 seconds, and I'm going to multiply it by 10. And so that way, like if I took it for a full 60 seconds, your heart rate would come down. That's not the number I want. The number I want is what your heart rate is in that moment. So the shorter the time, the better, because that means that like your pulse isn't going to come down. Or I'll have them wear an actual heart rate monitor, which is what I like to do. So that's the Rockport walk test, right? So what we do is we use this big complicated formula that looks like this, by the way, where it's like their weight and their age and their gender and their time and their heart rate, right? A lot of data. But instead of using that, what we will do is go to a calculator and we'll say our client is female, 45 years old, 210 pounds, and their heart rate at the end of the exercise was, let's say, 145. And it took them 14 minutes and 52 seconds. And I hit calculate, right? So that's not too bad, right? That gives them a fair score, right? Their VO2 max was about 28, which is not terrible, right? It's just about average or maybe slightly below average, right? But let's say the recovery pulse wasn't 145. Let's say at the end of that exercise, let's say the recovery pulse was we'll say 155. We'll just raise it by 10. That's still actually fair. Okay, 165. All right, so if we give them like a 165, let's say their heart rate's much higher, they're gasping for breath, that gives them a poor rating, right? Or let's go back to 145. Let's say it took them 17 minutes and 52 seconds. That's also going to give them a poor rating, right? Because it took them a very long time. Their heart rate may not be super high, but it took them a very long time to complete the test. So it gives us like a VO2 max score. And you can do this yourself, by the way. You can put yourself through this assessment, and it's kind of nice. What we're looking for, so we're looking for average VO2 max by age. What we're looking for is like your VO2 max is how much oxygen you can consume in like 1 minute's time. And the more oxygen you can consume, the better shape that you're in. Basically your blood cells, your muscles, your heart, all those things can supply plenty of oxygen, so you can consume lots of oxygen. That's a good thing. So we're looking for how much oxygen someone can consume. So if someone's 48, right, they'd fall between the age 40 and 49. And then like if their score is anywhere above 48, they're in great shape. If they're consuming, 33 to 38, they're in okay shape. If they're consuming less than 30, they're in not so good shape. We look at our client from before. Oh, I closed the window like a dummy. We look at our client from before who had this poor rating, right? Their VO2 score was 18, right? So it's a woman. She was how old? 45. And her score was 18. That's below 21. So that's in not so great shape, right? So we're going to give her a gentle routine, right? So you can use either assessment. You don't have to use both. Personally, I like the Rockport walk test a little bit more in terms of because it shows you VO2 max, which is just a handy piece of info. But I like the 3-minute step test more in certain settings because it's very easy and it only takes 3 minutes. So when I'm working in like a general gym, I will often do the Rockport walk test. But if I've got like a private client, we might take like a day trip to like a field and actually work out around like a track and do the Rockport walk test instead. Both are great. I'm a big fan of both. Any questions on those, guys? Questions about how either of those work? Feeling good? Okay, so next category we've got our postural assessments. You guys know about these, so I'm gonna move through them pretty quick. But you get static postural assessments, which is literally like static postural assessments are just, you're gonna have your client stand comfortably and you're gonna observe what you can see about their posture, right? Stand from the side, stand from the front. If you look from the front, you can see, I've got a slight shoulder rounding and a slight forward head posture, even without moving, right? I should be sitting a little more like this. So that little difference right there That's something you can observe statically. Just have your client like stand and look. You're going to look for any scoliosis, you're going to look for any rotations, things like that. There's a really great, if you guys want to watch a really great video on this, this Australian version of Sochi, basically. It's like an Australian school for personal trainers. Check out static postural assessment. They teach the NASM protocols. I think you do have to actually type in NASM. Where is it? Oh man, this used to come up like instantly back in the day. Now there's so many more videos on YouTube. There it is. Yeah, Australian Institute of Fitness. These guys have a great breakdown on postural assessments. There it is, right here. So if you get a chance, check out these postural analysis. They'll do an anterior, a lateral, and a posterior view. Check out all three of these videos. They're really, really, really great. It'll look like this. And then what you're going to see him do, the reason it's so awesome, actually, we'll do the posterior one because it's just like a great picture. They'll actually mark with these little like red stickers here. You can see she's got a scoliosis, right? If you look, like he put these stickers on her spine and see how it like S curves this way, right? So it's kind of cool. It's kind of a cool little video. And then they go down to her ankles. Actually, it's probably start at the ankles. And you can see she's got like eversion, right? So really, really handy, fun video on static assessments. It can help you train your eye a little bit. So check those out if you get a chance. These videos are super, super, super helpful. See how, like, again, see how like there's a huge gap here and no gap here? That's showing you the scoliosis. Static postural assessment, super, super helpful. And then we know the overhead squat, which you guys are slightly familiar with, and the pushing and pulling assessment. We're looking to see, do your feet turn out? Do your knees cave in? Do you excessively lean? Do you low back arch? Do you low back round? Do you shift laterally? Do your heels rise? Do your arms fall forward? Or do you have shoulders elevating in a forward head posture? And then we get a little bit into endurance assessments, right? So endurance assessments are also related to your aerobic capacity, but they really are all about like how far can you go with exercise, right? And so we have like the intermittent shuttle test. This is more commonly referred to as the pacer test. But if you guys remember doing, or sometimes you'll hear people call it the beep test, that one where you go and you got two cones and it's like beep and you run from one cone to the other and it goes beep and you run from one cone to the other and then the beeps get faster and faster and faster. That's an endurance assessment. You know, how many rounds can you make it? That's going to help you determine your VO2 max. So we love endurance assessments. They're great for us, right? It could also be a 1 mile run and then you just time it, right? Those are also good examples of endurance assessments. And then we've got our neuromuscular assessments. And neuromuscular assessments are also very, very common. And they're all about like balance, right? How well can you neuromuscularly control your body? So a single leg balance assessment's a really good one. You know, can you stand on one leg and raise your leg up off the ground without shifting your hips like crazy, right? Can you do that accurately? You know, I know that like, because I had all that SI pain lately, I was like kind of reassessing myself in the mirror the other day. And I was noticing that like, I don't shift very much when I stand there, but on this side, I'm shifting like crazy. I'm dropping this hip down a lot. So you can see like, yeah, I developed like a little bit of instability there because I spent like what, 3-4 weeks dealing with like low back pain that I don't normally have. So that's definitely, definitely something that, you know, I want to address, you know. I want to make sure that I don't end up like asymmetric and get more back pain later down the road. Or maybe it's like the STAR excursion test.
Yo.
Question?
Yeah, I got a question.
Yeah.
I heard that lower back pain usually sometimes could be caused by oral hygiene, like your mouth and stuff. It's some weird, man, like the nerves or something like that.
Interesting.
You might
That's not
have
one
like
I've heard.
like a, you know what I'm saying, like a nerve or some or a
Yeah.
tooth in there or something.
I have not heard that one. I could see that being the case if like you're a firm believer in trigger points and stuff.
Yeah,
You'll sometimes hear about that, but I would say that's more like a
they're
low
my
back.
nerves though.
Yeah, right. Like you'd have like a nerve, and so it's like it's creating like residual pain somewhere else in your body. That's like the theory behind like trigger points. I would say that that's probably like a nervous ache in your low back, more so than it would be like structural back pain like the other injuries we've been looking at, right? That's the difference between like nervous pain and musculoskeletal pain. I cannot see a scenario, personally, I can't see a scenario where a toothache would cause musculoskeletal pain elsewhere, but I could see it causing nervous system pain.
Right.
Just like, here's a weird one. Sometimes you'll get like pain in your low back and they'll give you a massage up here in your neck.
Yeah,
It's
called a pressure point, right?
Yeah, there's a trigger point connection between the two. So sometimes you'll see stuff like that. But that's interesting. I'll have to look that up. I do know, here's a fun one. Sometimes you'll see tooth pain and diabetes be connected.
Or could it be the way you walking, or you know what I'm saying?
More commonly,
you know what I'm saying?
Stuff like that. Yeah.
Yeah. Stepping too hard out of bed or something, you know?
Right. So those are neuromuscular assessments for sure, right? We definitely want to test for our balance and look for any of those distortions, because we know that like the number one cause of aches and pains are going to be you moving the wrong way, right? Moving your skeletal system in a way that's really not designed to move. So one of the really good ones is the STAR excursion test. I wanted to show you guys this. So if we look at the STAR excursion balance test. That's an interesting one. That's not what, yeah, this one right here. I was like, I don't know why he's holding a stick. Okay. Oh God, double ads. Ugh.
Video, I'm going to talk about the STAR excursion balance test in order to assess a patient's postural control, range of motion, strength, and proprioceptive abilities.
Okay, so the way this is going to work is you're going to have your client stand. Now, what you're going to do is she's going to reach for each one of these, on each one of these lines while she's standing in the center on one leg. And what you're going to do is you're going to measure how many inches she can reach on each one of these, and you're going to write all of her scores down.
Allowed, after which your patient can rest for 5 minutes.
Right, so she's struggling there. But like right there, God dang it.
After which your patient.
Okay, so she touched right about here, and then she clearly lost her balance, right? But that's about where she touched. You can see she's going behind her. You're gonna do this on both legs. So you are gonna reach on each one of these points with each leg. So for these three, you have to go kind of behind, right? And then this one circles back around the front. But you're gonna measure how many inches she can reach. The further outside of your base of support you can reach, the better balance you have. They actually sell this really cool mat that I had a somewhat similar version of where I used to work. This is, oh, where is it? STAR excursion mat. Oh, where is it? Oh no, it used to be up here. There used to be this really great, let's try this balance test mat. No. Oh, lame. I can't find it. There was this really cool little mat. That had a place for a tape measure that would hook to that mat. There it is. Ha ha ha.
Left foot.
So they're gonna reach out,
touching as far as you can,
and you put a little, like, you reach with like a stick, and then you measure it, or you mark it, and then what happens later at the end of the test, there's a little hook on the mat that allows you to attach a tape measure to it. and it spins and stuff. We had something just like this where I used to work, and it was super, super handy. So anyway, that's the star excursion test. The further out somebody can reach, the better balance they have. Another version of this is going to be the shark skill test, which is basically where you put a 9x9 box and you have your clients jump from each of these. By the way, this is what I want to do next time we all get together. Is I want to put up, I want to do all these assessments, and it'll be kind of a fun little competitive day where we can all. It'll be like the Sochi Olympics. We'll compete and see how many people can jump into these boxes. Now, this version here, these boxes are way too large. That's like a 2 foot or maybe a 1.5 foot by 1.5 foot box. The traditional test,
Hi, my name is
that's also pretty big, is a 12-inch by 12-inch box. So basically like your classic, like, there you go. That's a little bit better. So what he's going to do is he's going to jump from box to box to box while he's standing on one leg. And you're going to measure how quickly it takes. If he goes really fast, awesome. If he goes a little slower, well, we need to probably work on our balance. This is pretty good. Oh, he's going in a weird pattern. There we go. So basically he's going to measure how long it takes. You see how he's got a stopwatch? So that's a balance assessment, right? And it's always kind of fun to do. Then there's also like an upper body agility assessment. There's like the Davies test, which is where you put a box, you put a marker 36 inches apart on the floor, and in 15 seconds, you're gonna see how many touches you can get. 3, 4, 5, 6, 7, 8, and you're gonna go for 15 seconds and measure them. So all of those are neuromuscular assessments, right? You're testing your neuromuscular system to see how well it can perform. So during any of these assessments, the most important thing is that you are always, always, always going to look for the highest level of accuracy, meaning you're going to count accurately. Make sure that you are always looking for reliability, meaning that like you can reproduce that assessment exactly the same way every single time. So whenever you're doing assessments, guys, this reliability part is super, super, super important. You don't want to make your client do the Rockport walk test for 1 mile the first time they assess and 3/4 of a mile the second time. I mean, obviously that's a huge difference, but like you don't want to go to a track where you don't mark it off accurately to 1 mile, right? Because if you do that, your test is going to go shorter or longer, and then all of a sudden it's like, wow, what a huge improvement. And then next time you do it, you don't do it for the same distance, and it's like, oh, you got worse, you know? That's not good, right? That's like measuring somebody. This is why it's so important when you're taking like circumference measurements to not pull super hard, or to have your clients wear like different clothing. This is a little weird, but like, let me tell you, women's bras, for instance, when I've got my clients and I'm doing like chest measurements, you got to tell your clients like wear the same outfit every time, including the same sports bra. Because if they wear like different ones, all of a sudden their chest measurement drops 3 inches 1 month and then goes up 4 inches the next month. And it's like, what happened? And it's all because of the clothing they were wearing. And it'll totally throw, if you got a client who's like consistently losing weight and all of a sudden one of their inches goes up, that's going to make them feel like crap. So always make sure you are aiming for the highest level of reliability. Make sure your assessments are always the same. Don't put somebody through a shark skill test where the boxes are 2 feet large, and then the next time you put them in there like 1 foot large, right? That's going to throw off how accurate your assessment is. And always make sure that your assessments are safe. That is super important as well. You should always make sure that like your client has the capacity to even perform these assessments. Don't do the Rockport walk test if you don't think your client can walk a mile. Don't put your client on a 3-minute step test if you think that they're going to lose their balance and fall off that step, right? So make sure there's always a high level of consistency between your assessments, and write down in your SOAP notes what assessments you feel are most effective for your client. So the primary goal of exercise training is always, always, always to mediate the effective ability of your client, right? So you are looking at improving your client's ability, but you are also making sure that you are not pushing them too hard or too easy, right? So you're going to always like look for your clients like functional capacity and look to develop that functional capacity. And you want to make sure that you base it on increasing their overall lifestyle capacity, right? So increase that, increase their daily expenditure, try to get them to walk regularly, right? They should be engaging in exercise throughout the day rather than just like a lot of people just like they'll do their daily workout and then they'll spend the rest of the day in bed, you know, or sitting in a chair. So the primary goal of general exercise training is to improve not only your peak capacity, but also your general capacity. So when it comes down to things, you know, exercise is going to have a lot of really, really positive effects on your clients. Part of those positive effects, especially from like a diabetic standpoint or from a metabolism standpoint, is that it's going to help your body enhance the metabolism of both carbohydrates and lipids or fats, right? So your body is going to much more effectively through general exercise learn how to metabolize carbs and fats more effectively. That's going to lower your blood sugar levels. That's going to enhance how well your body can store carbohydrates, but it's also going to burn fat. And so that's always very helpful because like, you know, that is going to lead to less fat being throughout your cardiovascular system, which can lower your risk for cardiovascular disease. So our primary goals when it comes to general programming for exercise, especially with clients who have a lot of these comorbidities we've been talking about, is to enhance your peak aerobic capacity, right? So make sure that you are enhancing their maximal capacity, but it is also to improve their neural control of vascular function. So what we mean to that by neural control of vascular function, this is what I spent some time talking about yesterday. We want to get your body better at controlling your blood vessels, right? We want to get better at vasodilation and vasoconstriction. That way, you know, by exercising, your body's going to go, holy crap, we're using a lot of muscle. We want to make sure that we dilate the blood vessels to our muscles. So then all of a sudden you expand those, blood gets to your muscles, and your muscles have plenty of energy. Then once you're done exercising, your body goes, all right, we're not using those anymore. And so it constricts those blood vessels. So exercise is not only repetitions for your muscles, it's also repetitions for your blood vessels, which is really, really great. That's going to enhance that, but it's also going to enhance your heart's ability to pump blood over longer distances. So by increasing like how often your heart has to beat and also like increasing like that stroke volume by changing your blood vessel width, that's going to strengthen your heart. You know, cardio is basically a lot of repetitions for your cardiovascular system. That's why it's called cardio, right? Going for a jog, getting on a rowing machine, going for a swim. So that's going to be really, really great. That's going to help strengthen your heart, right? And then it's also going to actually improve the blood vessels themselves. These small muscles within those blood vessels are also going to strengthen. So you've got the nervous system controlling your blood vessels, you've got your heart strengthening itself, and you've got the blood vessels on a physical level also strengthening. All really, really, really positive effects. All right, so in general, when we're writing these programs, right, you want to make sure that what you want to review what you know about what effect those exercises have and how they affect your client's conditions, right? So if you have a client with osteoporosis, you're going to be like, all right, osteoporosis means low bone density. Then you're going to review what you know about, I don't know, let's say squat jumps, right? It's like squat jumps are really high impact. My client has low bone density. Is that a safe exercise to perform? Maybe not, right? Maybe that high impact could result in like a stress fracture in your client. So if your client has low bone density, maybe we choose not to do that. But you know what improves bone density if you have access to it? The power plate. This is sometimes found in certain gyms, but it's basically this little exercise machine, Google Images, that vibrates like crazy. Basically this little plate down here just goes and it vibrates in a really, really high frequency. Now, that seems a little weird, right? But if we can do that high vibration technique with a client who has osteoporosis, that might, with small amounts of impact, result in greater bone density. So that could be a really effective, really great form of exercise for our client, right? So review what you know about your client's condition, review what you know about physiology, and then evaluate your client in those areas. Consider what characteristics are unique to your client, right? What research do you need to do about your client or about their like different condition so that you can like figure out like what your overall goals and objectives are. One of the populations that we're not going to talk about in this class, but is a somewhat, I mean, not that common, but somewhat common one, is working with clients who have like multiple sclerosis. That's called MS. And it is a nervous system. It's actually an autoimmune disease where your own immune system actually eats away at your nervous system. So we look at like multiple sclerosis. I'm sure I'll get a picture here of a neuron. There we go. So what we see in multiple sclerosis, for some reason, our own immune system actually eats away at the tail of our neurons. And so you can see this damaged myelin sheath here. So what ends up happening is nervous system signals sometimes don't get to where they're going. So when you see somebody who has multiple sclerosis, sometimes they'll lose muscular control. So, they'll be walking normally, and then all of a sudden, like their leg will give out, and then, there's another nervous system signal coming right after it. So usually they don't fall all the way to the floor, but you'll see all of a sudden they'll lose muscular control. And it's because their nervous system can't get the signals to where it's supposed to go. So all of a sudden the muscle just doesn't contract the way it's supposed to. So we know that high temperatures actually increase those symptoms. So the priority when you're working with your client is, number one, to work on their balance like crazy, because they are going to lose their balance and there's nothing we can do about that. But if we can get them better at recovering and catching themselves, that's going to be huge. So reactive training and balance training are going to be super important to do with our multiple sclerosis clients, right? Also, keeping their body temperature low, making sure they always have water on hand, making sure the gym is not too hot. Both of those things are an absolute priority for our clients with multiple sclerosis. So something to be aware of there, right? So what we did is we did a little bit of research to understand how to work with our client. We worked with our client to determine goals and objectives, right? My client who had MS, we just said, all right, let's work on your balance, right? That's our goal. Those are our objectives. Determine what they are currently able to do. So again, like figure out what their functional capacity is. I think we've talked plenty about that. And then prioritize the parts of the program that are suited to your client's goals. So again, if your client has the goal of like, losing weight, but at the same time they have like diabetes, right? Well, we want to make sure that like their nutritional program is based on the recommendations from their doctor. And maybe some of those things are effective for weight loss, but maybe some parts of it aren't. And honestly, the most important thing is to manage the disease, right? Not to aim for the weight loss. So if it means that their weight loss comes a little bit more slowly, well, that's a bummer, but it's still what's considered healthiest. So make sure you are prioritizing things, right? I've had clients who come to me and they're like, I want to learn how to run a marathon. It's like, we need to work on your posture first. Otherwise, you're going to deal with like stress fractures and stuff. Let's work on your mobility, start with a half marathon, and then we can work our way up to that in the future. That's part of our job sometimes, guys, is telling people what they don't really want to hear and pulling back on that exercise. So I've spent a lot of time today talking about incorporating like exercise into your general lifestyle. What we are looking for, according to the CDC and the USDA, is we are looking for about 150 minutes of moderate intensity exercise per week, right? That's sort of like the general recommendations we look for. Alternatively, you can also look for about 75 minutes of high intensity exercise per week. So these are both questions on your test, by the way. I've had multiple students come back and say, I got the 150 minutes question. So make sure you guys get this one up in your noggins. So 150 minutes a week. of moderate intensity. All that means is go for a 30-minute walk every day. That's not that hard, or not even every day, 5 days per week, Monday through Friday, 30 minutes, right? Or maybe 3 10-minute bouts, right, of exercise every day. I'm sorry, 5 days per week, right? Alternatively, you could do 15 minutes of high intensity exercise, right? 15 minutes, that's 75 minutes per week. Do you guys remember that Tabata thing I told you about? Do you remember the Tabata? It's 20 seconds of work followed by 10 seconds of rest for 8 rounds, right? And so check a look. If you type Tabata, look at how many pictures there are of little like 20-minute no equipment workouts, right? That's 20 minutes. You do that 5 days per week. That's 100 minutes of, and this is high intensity exercise. So you just do each of these exercises 20 seconds on, 10 seconds off, and you do a certain number of rounds, right?
That's called Tabata?
Yeah, it's called a Tabata. Now, this isn't necessarily going to burn massive amounts of calories to result in a huge weight loss program, but this is all it takes to maintain a normal, healthy lifestyle, according to the CDC. So honestly, the simplest version of a Tabata, and this is absolutely as simple as it gets, 20 seconds on, 10 seconds off, do 8 rounds, jumping jacks. 20 seconds, rest 10 seconds, and do it again. Do 8 rounds of that. You do that 3 times a day, once in the morning. It takes 4 minutes, by the way, to do one Tabata, because it's 20 seconds on, 10 seconds off. That's 30 seconds. 8 rounds, that's 4 minutes, right? So you do that 3 times a day. That's 4, 8, 12 minutes. You do that 6 days per week, or 5, even 5 days per week. That's still what is that? 12 times. Yeah, that's 60 minutes per week, right? That's an hour. A little bit less than 75, but we can get up to 75. We just do that every single day. There's a lot of ways that you can get high intensity and moderate intensity. Just go for a brisk walk 3 times a day, 10 minutes. It's not really all that hard, right? And that's where it starts. Once you start from there, then we can start enhancing that and making that more intense. But this is what we want to get everybody up to baseline wise. So definitely get both these numbers memorized. They love to ask that question. All right, the last little bit. I know you guys have seen these a million times, except for you, Noel, this is your first time. But one of the things that we are also going to see are what are called your FIT principles. FIT principles are going to come back a lot. We're going to talk about these a lot, but these are general guidelines. When you're writing a program, you kind of want to think of these 5 things. So FITTE, frequency, intensity, time, type, and enjoyment. So these are basically the 5 things you want to consider. How often you're working out, right? That's your frequency. You want to consider what your intensity is. You want to consider how long it takes, time and enjoyment. You do not want to have high frequency, high intensity, and high time on your program. If you do all that, you are heading to overuse injury city, population U, right? If your frequency and your intensity are both high, you're never giving your body time to rest, and it's never going to recover. If your intensity and your time is high, you're going to end up overuse injuring because you're going to be sprinting for too high. In fact, really, you can't have high intensity and high time, you know? I think that Ultimate Frisbee is super intense, but I know that's not true because I play for several hours. I wouldn't be able to play for several hours if it actually was intense, right? I think it's hard, but that's different from intense. So frequency is the number of sessions in a given time period. We just talked about how if you were to do 150 minutes per week and you were to do 30 minutes a day, that frequency would be 5 days per week, right? The intensity is moderate, right? So if my intensity is the level of demand of my exercise, moderate intensity is like 65 to 75% of my heart rate max. If my heart rate max is 190 and I do 190 times 65%. If my heart rate's around 124, that's moderate intensity for me, right? Great. If I do that for 30 minutes, right? 5 days per week. Frequency is 5 days per week. Intensity is 65%, right? I'm going to be meeting the USDA recommendations. And if my time is 30 minutes, that's the length of time given in the activity. That's going to be enough for me to meet that minimum guideline, right? My type, let's say it's going for a walk, right? And then my enjoyment is how fun that is. And this is just a question that you always want to ask yourself. Does your client enjoy that exercise type, right? Is it something that they can adhere to and actually have a good time doing? Me, I love walking. I think it's a great time to listen to audiobooks, you know, but not everybody's going to feel that way. So when you're writing a program, if I go back to, like I said yesterday, if we look at that example SOAP note that we talked about, this is what that's going to look like. You can see, we already talked a little bit about it, right? We had our client, John Smith, who's working at Chick-fil-A, right? This is the guy we talked about. We know that he has some postural distortions. Our plan was to go on 3 10-minute walks that were brisk per day, right? So that's 3 low to moderate intensity walks. That right there is going to be enough for us to get our 150 minutes of exercise per day, but he's going above and beyond. We've also got 1 30-minute hike per day. I'm sorry, the 1 30-minute hike per week on there as well. Meanwhile, every single day he's doing a little bit of flexibility training where he's doing 10 repetitions, holding for 2 sets, 2-second holds each. So he's going to do a cladomastoid stretch, a levator scapula stretch, an internal rotator stretch, on a lat and a pec stretch. So we're going to have him do a routine that kind of looks something like this, that's really just based on stretching, right? 1, 2, 1, 2, right? He's going to do 10 reps of that. He's going to do 10 reps of this, where he's getting his levator scap, right? He's going to do 10 where he does his sternocleidomastoid, right? Right. He's going to do an internal rotator stretch, something simple like that, just a scarecrow stretch. A lat stretch. I don't have a lat ball here, but I would do like a foam roller or a ball, and then a pec stretch, right? Where he does that pectoral wall stretch. All he's going to do is 10 repetitions of that, go through that little circuit, and then repeat and do the same exact thing again. 2 rounds, 10 reps each. That's going to take him like 10 minutes, right? At the most. And then we're going to focus on total body workouts while we're in the gym. Now, remember, I wanted to show you guys this. This client has hypertension, right? So this is a client with high blood pressure. His blood pressure is 145/90. So one of the things we focus on is a full body workout. By focusing on a full body workout, that is going to ensure that we are evenly distributing blood throughout his body. We are training his blood vessels, right? Going back to earlier, we talked about how, one of our priority goals is to develop like our nervous system controlling our blood vessels, but also our blood vessels controlling the muscle within themselves, right? So we're always going to have a chair available if our client needs to get off their feet, but we are focusing on full body workouts, and we are doing strengthening of our upper body and postural muscles, right? So we're going to focus on strength training for his middle and lower trapezius. That's going to be a lot of rowing motions, a lot of A reverse flies, YTAs, ball combo number 1, ball combo number 2, right? Rotator cuff, deep cervical flexors, right? Little chin, we're going to keep his chin tucked throughout the whole workout. We're going to focus on 8 to 12 reps at a moderate tempo. The reason we're not doing a slow 4-2-1 tempo is, again, with hypertension, we are avoiding isometrics, right? So our isometric hold is always going to be 0 seconds. We are going to choose stabilization exercises, though. Noel, I know you don't know what that means. We'll get to that later down the road. Even though we're not doing those stabilization exercises at a slow tempo. And here's what's kind of fun. We are going to do what is called a peripheral heart action circuit. So this, guys, is a super awesome style of working out. And what it does is it evenly distributes blood throughout the body. So you'll notice what we did is we went to do a body weight squat, into a single leg dumbbell curl, into a walking lunge, into a single leg shoulder press. So he is going to go lower body, upper body, lower body, upper body, right? And so we start with squats, right? Once we're done with those, we're going to stand on one leg. We're going to do bicep curls. Then we're going to go into walking lunges. And then we're going to go into the opposite leg, single leg shoulder press. So by going from lower body to upper body to lower body to upper body, your blood vessels are going, great, lower body exercise, opens up all the blood vessels, sends blood to the legs. And then all of a sudden you switch and go to the upper body and your body's like, now I got to send blood over there, right? Like, so it closes the blood vessels to the legs and it opens up the blood vessels to the upper body. Then all of a sudden you go back to the walking lunges and your body's like, come on. And then it has to send blood back that way. Then all of a sudden we go back up to the shoulder plexus and it has to send blood that way, right? And so your blood is being sent throughout the body in different directions. And that's going to be really, really, really great because that's training your blood vessels to contract and relax and contract and relax, right? Dilate, constrict, dilate, constrict. That's one of the reasons why we love peripheral heart action so much. If you want to build endurance, start working out like this. Upper body, lower body, upper body, lower body. If you are doing a total body routine. If you're not doing a total body routine, you don't have to do this. Different goals, different folks. Avoid isometrics at all times, avoid slow tempos at all times, and avoid holding your breath. You will notice one thing that we did with this client as well, body weight squats, walking lunges, dumbbell curls, and single leg shoulder presses. All of those things are upright. I never had my client doing a hinging motion. Even though I love hinging motions, they are absolutely fantastic for you. We did not do them with our hypertension client because I do not want his blood pressure changing and all of a sudden they faint, right? So, and he's gonna do that 3 days per week. That's probably gonna take about an hour. So now we've got, let's see, 180 minutes of exercise just from strength training. We got another 150 minutes of exercise from walking, plus another 30 minutes of exercise from going on a hike. That is pretty lengthy in terms of time, but that is a huge commitment, and all of it was low to moderate intensity. If my intensity was higher, I would have to lower my time pretty significantly. But that right there is going to be a really effective weight loss and blood pressure program for that client. Do you guys have any questions about sort of how we came to some of these conclusions today? Today's like the last 2 days have been like theory days.
So my thing is, so you just doing the upper body and the lower body, kind of get the blood flow balance normal. You know what I'm saying? Going up both bodies, the whole thing.
Yep, absolutely.
Okay.
So that's
usually, right. Because usually we do just the upper body one day, and then we do the lower legs day, and then we do arm day or shoulder day, stuff like that.
Yep, I love that. So that's a great way to build strength because you are focusing on like or strength in those particular body parts, right? So that's sometimes affectionately referred to as the bro split. Chest day, back day, leg day, shoulder day, ab day, arm / ab, right?
You're kind of unbalancing yourself, huh? Like
well, not necessarily.
Kind of growing in one place other than the other.
Well, not necessarily. If you're like a bodybuilder, that's a great way to be like, all right, I'm focused. And like the more rather than being like scattered and thinking about too much all at once, you're focused on one thing at a time. That's totally okay. But with a client like this, like a client with heart disease or a client who's prioritizing weight loss, those types of programs aren't really effective because like you do your chest and then you have to wait an entire week before you get back to your chest, right? So it's not optimal for that type of client. But if I were trying to like carve out my chest, like let's say I have like a definition problem on like my lower pec, right? I'm like, man, I just can't get the bottom part of my pec to look like it's separated from the other part of my body, right? Well, then by doing a lot of like isolation techniques for like my lower pectoral muscles, right? Things like dips, things like a decline chest press or high to low flies, right? Sorry, low to high flies, what am I talking about? If I'm doing stuff like that, that's going to help me like sort of carve that out. So now by having like a chest day, I dedicated, you know, my energy and my focus to one specific thing. That can be great. It's just not great for this type of client. Different strokes, different folks. So I'm not saying those routines are bad. I like those types of routines. But any other, any other questions? That was a good one.
Is there any science behind the bro split possibly leading to like hypertension or anything like that?
Probably not. Not unless somebody's like holding their breath a lot. And then, I mean, if they don't, like, there's weird things that can lead to hypertension. If you reverse your breathing, for instance, that can sometimes lead to hypertension. So like inhaling as you're pushing and exhaling as you're pulling is kind of the opposite of how I want to do it. You want to exhale concentrically and inhale eccentrically. So like sometimes that can lead to hypertension the other way around. Excessive holding of your breath consistently can sometimes lead to that. And then not cooling down and not warming up can actually sometimes raise your blood pressure because basically your body is like, do stress. And then it's like, and then because you didn't cool down, your body doesn't know that that stress is over. So it just starts making like stress hormones like crazy. But I don't think that's the bro split's fault. I think those are just bad exercise habits. Any other questions? All right, so you guys are gonna get homework 1 for this class up today on Canvas. You're gonna find that in no time. Be aware, a lot of them are gonna be fit principle questions. I just know it because that's, there's just not a lot of info in some of these first 2 PowerPoints. So your exercise recommendations, that's going to be definitely some test questions, and your frequency, and then probably some general questions about what defines some of those diseases we look at. What is cardiovascular disease? What is diabetes, right? So peel through your notes. All the answers will be, in the PowerPoints or in your notes. And you guys are going to have a great weekend. We do have class on Monday, by the way, despite Columbus Day, just so that everyone's aware. And yeah, that's it, guys.
All right, you guys.